Today, the talk is basically on managing the surgical infections, avoiding complications. Already, Dr. Shinoy sir has already highlighted and mentioned about the simple aspect of abscess, and the most complicated one will be Dr. Barucha's talk, that is intra-abdominal abscess. And in between, I'll be talking on the abscess in view of sepsis. So now, certainly, any of the abscess cavity which is not being treated properly eventually leads to sepsis. And now, to go ahead for the sepsis, we need something, a new markers, that is called as biomarkers for the sepsis, which will take us to right path. As we all know, sepsis is an important public health issue globally. Despite an advanced medical care, modern medicines, over 5.3 million people, that is 30% of mortality is there. Early diagnosis of sepsis is usually complex due to unknown sources of infection and vague sepsis syndrome definitions. Now we all know, like sepsis, it's all about the time, the temperature that is higher or the lower than the normal. Infection may have signs and symptoms of an infection, mental decline, and extremely ill. I feel I might die with severe pain and discomfort. It's all about the time. Again, we follow this. We have these two main strategies going for sepsis. Detection of positive organism, which is often slow and usually takes time, sometimes becomes negative. Now, detection of the host response. The news for this patient giving history of fever, tachycardia, tachypnea. Then again, to add to this, we get this conventional lab tests like WBC, CRP, etc. As we all know, sepsis leads to inflammation, coagulation, tissue damage, and tissue repair. The sicker you are, the greater are the changes. We can identify, measure, stratify, prognosticate based on the biomarker levels for these processes. Now, this is a flow chart. Usually, whenever there is an insult in terms of anaphylactic shock, trauma, major surgery, burns, they usually trigger the two pathways, that is PAM, that is pathogen-associated molecular pathways, and damage-associated molecular pathways, which in turn, this affects the sensory and the effector cells, majorly the complex protein synthesis, the vascular and tissue cells, and blood and lymphatic cells. In turn, this results in release of the mediators and the biomarkers, which in turn then later on affect the organ function, all brain, lung, CVS, kidney, liver, gut, and microcirculation. Now the outcome, whenever there is an effective source control, the biomarker abnormalities will return to the normal. There is a resolution of organ dysfunction and patient recovers. The other side, ineffective source control, the biomarker abnormalities will be there. There will be a multiple organ failure followed by death. A diagnostic as well as prognostic role in management of severe sepsis. CRP and PCT have widely been used to facilitate the sepsis diagnosis, but the diagnostic and prognostic values are very limited. Biomarkers, apart from the use in differentiation of the local or disseminated infection of the sepsis, also been evaluated from differentiation of bacterial infection versus the viral and the fungal infections. Early recognition of the treatment success, early de-escalation of antibiotics, in this way the biomarkers definitely helps. Last but not the least, new septic biomarkers like trisepsin, that novel biomarker, TREM1, IL-6, IL-27, cell-free DNA and mRNA are being evaluated for the sepsis, but again not validated. These are much more found to be in literature. Its validation is yet to get it. So this is all about the septic biomarkers. I hope the basic septic biomarkers in terms of the role of lactate levels, CRP and PCT has been really clear to you all. Thank you so much.